If I piss for ground and after some minutes I see and say sugar ants gather around the piss, it means I get diabetes. Hey super people, welcome to another episode of the Ask Doctor series powered by Shape Up African. Today I'm here to answer 5 questions on diabetes. The first question reads, what is the difference between type 1 and type 2 diabetes, and does the treatment differ? Diabetes means the amount of sugar in your blood is higher than normal, and there are chemicals in your blood that actually help to regulate the amount of sugar in your blood. One of the most important chemicals is insulin. So in type 1 diabetes, you actually lack insulin, and so you can't properly regulate the glucose in your blood. In type 2 diabetes, you have insulin, but it doesn't function properly. And yes, the treatment actually differs. In type 1 diabetes, we have to give you insulin because you lack insulin. And in type 2 diabetes, we give you drugs that can help regulate the sugar. And in some cases, we can also add insulin when it becomes difficult to control with drugs. And not only that, the risk factors for both of them also differ slightly, though there is some kind of an overlap. In type 1 diabetes, it's mostly genetically related. But in type 2 diabetes, you have genetic factors and you have lifestyle factors such as obesity or overweight, alcohol, smoking, high cholesterol in the blood, and lack of exercise. So both the genetic factors and these lifestyle factors interplay to put you at risk of type 2 diabetes. So type 1 diabetes, you don't have insulin. Type 2 diabetes, you have insulin, but it doesn't function properly. The treatment differs and the risk factors also differ slightly. Question 2. If I piss for ground and after some minutes, I see sugar ants gather around the piss, it means I get diabetes? I go say yes and no. Yes, because if it points towards the fact say you get diabetes, and no, because if it also be as a result of the fact say you don't chop something where you oversweet, where it pass for your piss, and so that sugar ants they be gather around the piss. So if you see that kind of situation, so just go check for hospital. Send me they check your blood sugar and me doctor tell you whether you get diabetes or not. Question 3. I have been diagnosed of type 2 diabetes and placed on drugs. Does this mean I will take drugs for the rest of my life? Again, I will say yes and no. For some patients, they actually have to be on those drugs for the rest of their lives. But for other patients, in fact, I have personally witnessed patients that have been taken off their drugs when they modify their lifestyle. As in, you reversed your risk factors, and with time, your sugar becomes controlled even without drugs. Some of these lifestyle modifications include 1. Your nutrition, very important. 2. If you have habits like smoking and alcohol drinking, then you have to stop that. Lack of exercise. If you start exercising and if you're obese and you lose some weight, you can actually reverse diabetes and get off drugs. So what I'll advise is you should get someone who can act as a nutritional coach or a dietary counselor, guiding you on what to eat and how to eat, so that in that way, even if you're obese, it can help you lose weight, it can help you get into some exercise, into an active mode, and also regulate the amount of fat in your body. And one of such programs is the Reverse Diabetes Africa, which has just been launched by Shape Up African to help people reverse type 2 diabetes. Question 4. Treating diabetes is hard. I was restricted from eating almost everything. I gave up and have not even gone back to check. I beg, something must kill a man. Oh, I'm so sorry about this, but I would say it's not as hard as you think. Reason I say you should enroll in a program or you get someone to act as a nutritional coach or a dietary counselor to actually help you through this. I will say again, the Reverse Diabetes Africa is a program that I will recommend for everyone who has type 2 diabetes and wants to get on a lifestyle modification program. With this program, you'll be able to modify your lifestyle, know what to eat, how to eat it, and also get healthier alternatives to what you've been restricted from eating. With Reverse Diabetes Africa, you're still able to enjoy some of your favorite meals, but with just some modifications with regards to the cooking, the portions, and other things. So Reverse Diabetes Africa is actually the program that you should get on. The fifth question: is it true if you have a wound as a diabetic patient, it will never heal? And how does diabetes cause blindness? Poor wound healing and blindness are some of the complications of diabetes, including other complications like kidney failure. Sometimes it could have effects on the heart and even to the brain. So the fact that you have a wound as a diabetic doesn't mean it's not going to heal or you're going to have your leg cut off. If your sugar is well controlled and you have a wound, it's going to heal. The same way like blindness, if you have diabetes and your sugar is well controlled, it's not going to progress to the level that it causes you blindness. Reason we still insist, if you're a diabetic patient, you should stick to your drugs. And if you have been taken off drugs because your lifestyle modifications are optimal, you should continue maintaining it. And that's why it's important that you're in some kind of a program or a kind of support group so that it keeps that motivation up and you can continue controlling your blood sugar level using your lifestyle modifications or the drugs or a combination of both. Thank you, super people. Those are the 5 questions I came to answer today. Thank you for sticking around. This has been Dr. Gwashi Christabel for the Ask Doctor series powered by Shape Up African. Till next time, I remain your host. Thank you.